As far as the billing and coding goes with Practice Director, what we previously did with a paper exam form is we had a routing slip or a super bill, like in most offices, where we would circle the service that we did and then we would indicate a diagnosis code. It's really no different now with Practice Director. It's just done electronically. In my case, my staff is very well trained. They're able to look at the insurance that the patient has. We apply the appropriate code. Practice Director has a great scoring form function. I believe Dr. Brownlow had some input on. So we'll use that to actually score any of the medical visits, and we find that frequently coding higher than what we would have selected, so that's certainly been nice as far as reimbursement goes. And then that all just transfers directly out front, right to the front desk team as they're checking the patient out. So all that information just moves nicely without having somebody to re-enter that information. Practice Director, has got things streamlined as far as drop-down boxes, and you can load normal exams and pull from history, and it all makes that, very simple to do. Looking back and having some time to reflect on that, purchasing Practice Director has been a great choice for our practice. It's really allowed us to streamline things. It gives us a very technology-forward image, when our patients come in.
We do see a lot of disease. It's not uncommon to see macular degeneration, glaucoma, cataracts, dry eye, foreign body removal all in one day, along with our other eye exams that's scheduled in routinely. And so we found that Practice Director has done a very good job with allowing us to document the things that we need to for the coding of these medical visits. There's a button at the bottom of the screen that will help us to score a form. Allows us to not only not overscore but not underscore either, and actually get paid what we're supposed to be getting paid for doing the work that we've done. And so that's very important. There's certain areas in the EHR that allows us to have documents scanned in. There's areas where for different testing, if we have a diabetic retinopathy patient that we might think has macular edema, there's an area there that allows us to write down the reason for why we're doing the test, the results of that test, when you're going to bring them back. And so the different components that insurance companies are looking for, the Practice Director does do a good job with that aspect. We've been happy with that.